Thank you very much for joining to this new lesson of the series Psychoanalysis for Dummies, as I like to call it. In our last session, we saw how some mental health disorders create symptoms in the body. For now, let's put aside hysteria. It is a mental health which is slightly different, and let's focus on anxiety and hypochondria. Let's start. Anxiety and hypochondria, if left untreated, can lead to a psychosomatic disorder, and that is really bad. Why? Let's recap. Remember that both anxiety and hypochondria create symptoms in the body. However, it is just a functional injury. There is not an injury in the body yet. Let's say I have a panic attack, my heart is pounding, it is super accelerated, but the muscle of the heart is not damaged. If I go to the doctor, he won't be able to find anything. On the contrary, in the case of the psychosomatic disorder, there is an injury in the organ. This mental health disorder is more severe. It damages the body. The muscle of the heart would be damaged. It does not mean that every time there is tachycardia and shortness of breath, the heart is damaged. But thanks to psychoanalysis, I know which mental health disorder causes those symptoms. So, in order to be able to treat them and cure them, I need to understand which psychic structure is behind them. Make sense? In order to be able to treat psychosomatic disorders, patients need to talk. However, what happens with psychosomatic patients is that, to them, talking is very difficult. Hysterical and hypochondriac patients are very different. They can't stop talking about their symptoms, what happens to them, how they feel, sometimes even in a theatrical way. Psychosomatic patients aren't like that. They could say, I have an ulcer, but that's it. They don't talk about their lives. Why is that? This mental health disorder is very, very complex. There is regression to stages prior to the Oedipus complex, to the mirror stage. That is why, to them, it's so difficult to speak. It is a way of denying the psychic side of things. At the end of the day, this happens to all of us a little bit. However, in psychosomatic patients, it is exaggerated. The treatment for people suffering from psychosomatic disorders is to let them speak, so they can elaborate their psychic apparatus. As I have already mentioned, not treating anxiety can have consequences for our overall health. For sure, you will have a hard time, but on top of that, there are other reasons to make sure you treat your anxiety issues, not only the risk of end up developing a psychosomatic disorder, but also because we can have an attack. If we have an attack, we will land in hospital and, unfortunately, we will need to have drugs. However, the treatment that person needs is psychical, because why has that person had an attack? The attack has been triggered by psychic conflicts. So, only treating the psychical side of things, the physical side of things, the heart, will not solve the problem. Make sense? If we suffer from anxiety or hypochondria, doctors won't find organic disease. That is why doctors get angry at people who suffer from hypochondria. They feel they are wasting their time. On the other hand, hypochondria patients feel mistreated by the system because they suffer a lot and doctors don't seem to find the disease they have. It is true they are sick, but their disease is not organic. It is a mental health disorder. Does anxiety, hypochondria always lead to a psychosomatic disorder? No, if we treat it with psychoanalysis. We then don't reach the point in which our psychic conflicts reach our body, injuring it. We don't need to sicken our body. What happens in real life? The minute we have a psychosomatic disorder, there will be an injury in the body. If I go to the doctor, and because unfortunately they don't have psychoanalytical education, they will do their best. They will do the best they can treating the physical injury. However, as we said before, that won't fix the problem because that physical injury is the result of a psychical conflict. So if we treat with medicines the physical problem, we will become chronic patients with a chronic disease. But the root cause of the injury, the psychic conflict, continues untreated. That is why it is so important to be able to identify the specialists that can treat us. It would be really useful if doctors and health practitioners have some education of psychoanalysis. It would help a lot to maximize NHS resources, so much needed, by the way. If only they teach us mental health at school, we would be able to identify what type of health practitioner can help us. Let's now see in more detail what's going on in a psychosomatic disorder. It is a very complex disorder. I hope you can understand it a little bit and also how you can prevent it with psychoanalysis. It is important you understand this because someone can end up, for example, with an ulcer for not having been able to process a psychic conflict. Because he could not deal with a mental conflict, he harms his stomach with all that implies. Restriction diet, not being able to enjoy life to the full. There is no need to reach that point and suffer. Remember that if we leave anxiety and hypochondria untreated, we can develop a psychosomatic disorder. It is a severe disorder because it can lead to severe conditions like autoimmune disease. Unfortunately, more and more common these days. Traditional medicine cannot explain them. Best case scenario, they recognize that the psyche is involved, but they become chronic diseases because they don't know how to treat them. Functional medicine, naturopathy, have made big progress on the field, being able to start reversing some of these conditions in some people and in others improving a lot their quality of life and helping them to live off drugs. However, in many other cases, most of them, despite the effort of both practitioners and patients, the disease improves, but it's always there, or disappears and comes back, the horrible or the fear flare-ups. It is time to include and take into account our unconscious mind. In all autoimmune disease, our immune system is affected. And our immune system is deeply linked to our psychic life. That is why it's so important that on top of the medical treatment, the person has psychoanalytical treatment. According to traditional medicine, these 7 diseases are psychosomatic. Psychosomatic in the sense that the psyche impacts the soma or that the mind impacts the body. Stomach ulcer, rheumatoid arthritis, colitis, dermatitis, and hypertension. This disease becomes chronic, and depending on the severity of the disease, the life of the patient will be more or less impacted. Sometimes they can even be mortal. What is the view of psychoanalysis on these diseases? According to psychoanalysis, psychosomatic disorder is another mental health disorder like hysteria or OCD, obsessive-compulsive disorder, a position in the language. Something that can be changed with psychoanalysis therapy. Psychoanalytical hearing allows us to identify which is the mental health disorder behind its symptoms or disease. Same sentence said by a hysterical patient has a totally different meaning than the same sentence said by a psychosomatic patient. Let's have a look with an example. Let's say a hysterical patient says, "I fear my mom will die." A psychoanalyst, thanks to his studies on the psychoanalytical theories, can interpret what in reality the patient has in her mind without knowing it. I wish my mom die. I fear my wish comes true. There is an unconscious wish of that. She wishes her mom dies. However, that same sentence said by a psychosomatic patient, I fear my mom die, in that case is fear. There is not an unconscious desire of death. The important bit here is the psychosomatic disorder, the anxiety. There is a quantum of floating anxiety which can be randomly linked to feared representations. As explained before, not everybody who suffers from anxiety and or hypochondria ends up developing a psychosomatic disorder. However, they are at big risk. It has been proved that people suffering from psychosomatic disorders have suffered previously from long-term anxiety and or hypochondria. That is why it's so important that you treat it as soon as possible. Remember, if you have anxiety or hypochondria, there is not yet an injury in the body, but if you develop a psychosomatic disorder, that is a step further. the antibody is damaged and it can become chronic. Some feature in the psychosomatic patients will be they find it difficult to talk. They use closed sentence. I have an ulcer. Why? Because these patients find it very difficult to manage uncertainty. Remember that anxiety appears when we cannot tolerate uncertainty. Believe it or not, these patients prefer the certainty of the disease than the uncertainty of not knowing what the future will bring. Another characteristic is that they talk with a monochord speech. Life this did to me, but they don't seem to be involved in anything that happens to them. Regarding their relationships with their partner, for example, they are very rigid. They want the other person to be a photocopy of themselves. They can't tolerate differences. Every time the partner does not behave as they want them to, the couple is at stake. They are very intolerant. From the very beginning, they aim something impossible. They pretend the other person to be exactly as they want them to be. That is impossible. We all have our complexities. We all have our desires and our ways to do things. Psychosomatic patients behave like that with their partner because they are trying to eliminate the difference. I'm not going to go deeper into this as it's too complex for today. Just bear in mind that learning to tolerate differences is an important part in our psychic apparatus development. Psychosomatic patients struggle a lot with that. Treatment for psychosomatic patients is to let them speak. They need to learn to talk. They find it painful to think. Why? Because future is uncertain. And on top of that, death is in the future. They can't accept that. They can't accept one day they will die. They prefer to seek an organ rather than accepting reality. I hope I have not scared you. I just wanted to emphasize the power of psychoanalysis in prevention of disease and its role in our well-being. In our next session, we will move to a very different but also very common disorder, depression. I hope I talk about it in a positive way, showing you the reality behind it and most importantly, how you can avoid it, or if you already are suffering from it, how you can overcome it. See you next time. I hope you are enjoying.